Today we're going to talk about a little bit of a sensitive subject, and that's anal condyloma or anogenital condyloma, or a more common term would be venereal disease warts. Now, the most important thing that you can take home from this talk is that can be prevented. Anybody that's sexually promiscuous, in my opinion, should have the vaccine. And all adolescents should have the vaccine, because we know that certain strains of this virus can lead to anal cancer, and that cancer can be prevented by the vaccine. This is relatively controversial, as most vaccines are, that there may be some hidden dangers and some things to worry about. But in my experience with a very sexually promiscuous society, particularly today, if we can prevent anal cancer, we should do everything in our, we should focus on preventing it when we have the ability to do so. So let's talk about it a little bit. Here's what happens. Skin is where the virus enters. So what happens is that virus enters in the skin, and it starts the skin over-replicating too quickly, and they form these kind of fleshy verruca, meaning wart-like lesions, and they're highly infectious, and you get a lot of kissing lesions. And what happens in the area of the anogenital area is that oftentimes people don't realize that that's what they're feeling, and they think it may be a hemorrhoid or a fissure or some other anorectal abnormality, and they put hydrocortisone on it. When they do that, that lessens the immune response, and then they really go crazy. So it's important to remember that this is a virus, and it's sexually transmitted. There's certain treatments. Some treatments involve excising them. Some treatments involve putting chemical agents on them to destroy them. Some treatments involve injecting them to make your immune system respond to the virus. And ultimately, what we want you to do is confer a natural immunity, so to speak, so you can clear the virus, and hopefully it doesn't come back. The other thing about anal condyloma that you want to remember is that certain populations of people that frequently use anogenital intercourse, which is much more frequent than it used to be, have a higher chance of having what we call anal dysplasia, meaning the junction between the skin and the mucus producing cells becomes an area of high risk for cells that can grow abnormally. In the early phase, we call that dysplasia, and in the late phase, it can actually turn into cancer. So there's a procedure where you can look at these. One, where you can take some of that, you can put it on a slide, you can look at these cells, and that's called a anal pap smear. And if that's abnormal, then you go back and you look at this area under high resolution anoscopy. And if you see lesions that look suspicious, you biopsy those, send them to the lab. If they come back positive, then you go in there and you destroy these areas so that it will ultimately help prevent anal cancer. So if you have a history of anal condyloma and you're at high risk would be anybody having anal receptive intercourse, you should get a PAP. If that PAP comes back positive, you should get high resolution anoscopy. If the biopsies of the high resolution anoscopy come back positive for precancer, you should get those lesions removed, and then you should have frequent follow-up with high resolution anoscopy so you can prevent anal cancer. But the best way to prevent anal cancer is to get the vaccine. That's my talk today on HPV. Any questions? Feel free to leave a comment and we'll get back to you. Have a good day.